Welcome back, everybody, to another deep dive with us. Today, we're going to be tackling a fascinating area,
Oh, yeah.
rehabilitative nursing,
Um,
a field that, honestly, you might not think
Yeah.
about every day,
right.
but it's absolutely crucial.
Mm.
And get this,
Okay.
our source material today is a California community college
Oh, wow.
curriculum module for training nursing assistants.
Interesting.
So we are going straight to the hands-on practical stuff here.
I like it.
So basically, we're getting a sneak peek into how these professionals
Mm.
are trained to help patients regain their
Yeah.
independence after illness or injury.
Like, how exciting is that
Right.
to have that kind of insight?
So think of someone
Yeah.
recovering from like a stroke or surgery.
Mm-hmm.
It's not just about getting better medically.
Right.
It's about rebuilding their lives.
Exactly.
That's where rehabilitative nursing comes in.
Makes sense.
And what I find so interesting is this curriculum emphasizes that it's not just about basic care. It's about reaching the highest possible level
Oh, wait.
of physical and psychological functioning for that person.
Yeah. That word potential really stands out to me.
Doesn't it?
It's like you're helping someone become
Right.
the best version of themselves
Yes,
given their new circumstances.
exactly.
You know?
Rehab is a journey, not a destination.
Absolutely.
Love that.
It's all about progress, not perfection.
Right.
And the curriculum actually outlines
Okay.
two main categories of goals for rehab,
Okay.
physical and psychosocial,
Makes sense.
which I think really nicely captures that holistic approach
Absolutely.
to this type of care.
Yeah. So can you break those down for us a little bit?
Sure.
What kind of goals fall under each category?
So on the physical side,
Okay.
you've got, the obvious things like
Mm.
regaining mobility and strength.
Sure.
But it also gets down to the nitty-gritty
Okay.
of daily life,
Right.
helping patients relearn how to bathe and dress and eat, things we often take for granted
Really?
until we can't do them.
And I noticed the curriculum even mentions
Yeah.
adapting to assistive devices,
Mm-hmm.
which makes total sense.
For sure.
Those tools can be a game changer
Totally.
for someone's independence.
Right.
Yeah.
And then on the psychosocial side,
Okay.
the goals get even more interesting to me.
Oh, really?
It's about helping patients adjust to their disability,
Okay.
recognizing their accomplishments, and rebuilding their self-esteem.
So it's not just about the physical.
No.
It's about the mental and emotional well-being, too.
Yeah, exactly.
Okay.
And there's even a section on job skill development.
Really?
Like they're saying, okay,
Wow.
you're recovering,
Yeah.
but let's also think about your future,
Right.
your ability to work and contribute to society.
That's amazing.
It's a very forward-thinking approach.
It is.
I think it really acknowledges that
Yeah.
a person's well-being.
Goes beyond just their physical health.
Absolutely.
I love that.
It's multifaceted.
Okay, so that makes me think
Yeah.
about the team involved in this whole process.
Oh, yeah.
Because you can't achieve these kinds of goals in isolation.
Absolutely not. It takes a village.
Right.
The curriculum actually lays out this incredible roster
Okay.
of who's on this rehab team.
I'm ready.
So we've got nurses, of course.
Sure.
And then we've got therapists,
Okay.
physical therapists, occupational therapists, speech therapists,
Wow.
you name it.
The whole gang's here.
Right. And then
Yeah.
we also have the physician,
Mhm.
and then activity leaders,
Okay.
social workers,
Interesting.
even clergy and dietitians.
Wow. That is quite the team.
It is.
So I'm guessing the nursing assistant
Yeah.
is right in the thick of it all.
Oh, they are essential.
Yeah.
I mean, think about it.
Yeah.
They're the ones providing that direct hands-on care,
Right.
observing the patient's responses, encouraging participation. I
Yeah.
mean, their insights are invaluable to the entire team.
It's almost like they're the eyes and ears of the whole operation.
Exactly. They're the ones picking up on those subtle changes,
Oh, wow.
those little victories
Right.
that might go unnoticed otherwise.
So if you were a nursing assistant, you'd basically be on the front lines
I think so.
of this person's recovery,
Yeah.
witnessing their struggles and their triumphs firsthand.
I think that's got to be one of the most rewarding aspects of this field. Seeing those small steps forward,
Yeah.
knowing you're playing a part in
Right.
someone reclaiming their life.
And it's not always easy.
Right.
Oh, of course not.
I mean, the curriculum also talks about
Oh,
preventing complications,
right.
which reminds us that rehab is also about preventing further decline.
Right.
It's not all sunshine and roses,
No.
right?
That's such a crucial point.
It is.
We tend to think of rehab
Yeah.
as purely restorative.
But there's this preventative side as well.
Okay.
Imagine someone recovering from a stroke.
Sure.
If they're inactive,
Yeah.
they're at risk for things like pressure sores,
Oh, gosh.
muscle atrophy,
Right.
even pneumonia.
Wow. So it's like a domino effect.
Exactly. One problem can lead to another if you're not careful.
If you're not on top of it.
Right. And that's why
Yeah.
this curriculum stresses the importance of being proactive.
Okay.
Things like regular repositioning, breathing exercises, and especially ambulation.
Oh.
Even just standing for a few minutes
Right.
can make a huge difference.
Wow. I love that detail.
Yeah.
It shows how much attention to detail
Right.
is involved in rehabilitative nursing.
Yeah.
It's not just about fixing that initial problem. It's about keeping the whole person healthy.
The whole person.
And functioning as well as possible.
Yes. And that brings us to one of the core concepts of rehabilitation. Range of motion, or ROM.
ROM.
Yeah.
I remember that from gym class.
Right.
But I'm guessing it's a lot more
I think so.
important in this context.
Oh, absolutely.
So what is it?
Think of it this way.
Okay.
If someone is immobile for a while, their joints start to stiffen up, lose flexibility.
Yeah.
ROM exercises are basically moving those joints through their full range to maintain strength circulation and prevent that loss of mobility.
Wow. Okay, that makes a lot of sense.
Yeah.
And the curriculum mentions different types of ROM, right?
Yes, there's active ROM,
Okay.
where the patient moves their own joints.
Okay.
Then there's passive, where the nursing assistant does the moving for them.
Okay.
And then there's also active assistive, which is a combination of the two.
So even in something as simple as moving a limb, there's this whole spectrum of patient involvement.
Exactly. And the goal is to maximize
that involvement whenever possible, because the more engaged the patient is, the better the outcome tends to be.
I can see that.
Right.
The curriculum even gives specific examples of ROM exercises.
They do.
Like, I imagine it must take a lot of patience and skill to guide someone through these movements.
It does.
Especially if they're in pain or discouraged.
Absolutely. But imagine the feeling of helping someone regain even a little bit of movement.
Yeah.
It's like watching a flower slowly opening petal by petal.
That's a beautiful way to put it.
Thank you.
It's about those small victories that add up to something much bigger.
Exactly. And those victories are often aided by adaptive devices.
Okay, so let's talk about those.
Sure.
What kinds of devices are we talking about?
Well, it runs the gamut.
Okay.
From simple things like footboards to prevent foot drop.
Okay.
Or trochanter rolls to keep the hips aligned.
All the way to wheelchairs, prosthetics, and communication boards.
Wow.
It's all about finding the right tools to help each individual regain as much autonomy as possible.
So it's about meeting people where they are.
Exactly.
And giving them the support they need to function at their best.
Yeah.
Whatever that looks like.
That's a great way to put it.
Right.
Think about the everyday tasks we take for granted.
Yeah.
Eating, dressing, even just getting around adaptive devices can help people reclaim those abilities.
That's amazing. The curriculum highlights one device in particular.
Oh, yeah.
The overhead trapeze, which that kind of made me think of a circus.
I know.
But I'm guessing it has a much more practical application here.
Much more practical. So tell me about that.
It's not just for swinging around.
Okay.
It actually allows patients to participate in their own care.
Wow.
They can use it to reposition themselves, get in and out of bed.
It gives them a sense of control.
Right.
And it helps maintain upper body strength, too.
It's amazing how something so simple can be so empowering.
Right. And that really speaks to the philosophy of rehabilitative nursing.
Yeah.
It's not just about doing things for patients. It's about enabling them to do things for themselves.
Fostering that sense of self-efficacy.
Exactly.
That belief in their own ability to heal and thrive.
Yes. Which leads perfectly into another often overlooked aspect of rehabilitation, self-esteem.
Okay. That's a fascinating connection.
Is it?
How does self-esteem play a role in this whole process?
Well, think about it.
Go.
If you're recovering from a serious illness or injury, your sense of self can take a real hit.
Right.
You might feel weak, dependent,
even
a burden to others.
Oh, yeah.
But if you have strong self-esteem, if you believe in yourself, you're much more likely to engage in therapy, push yourself harder, and ultimately achieve better outcomes.
So it's almost like self-esteem becomes this fuel
Totally.
that drives the recovery process.
It's so important.
And the curriculum stresses the importance of fostering that self-esteem through therapeutic communication.
Right.
Okay, so what does that look like in practice?
Well, it's about respecting the patient's wishes.
Okay.
Offering encouragement. Celebrating even small accomplishments.
Right.
It's about listening to their fears and concerns.
Okay.
Validating their experiences and reminding them that they're not alone in this journey.
So it's like those seemingly small gestures
I think so.
can have a huge impact
They absolutely can.
on a person's motivation and outlook.
Yes, it's amazing.
Isn't it?
How much power a kind word or a genuine smile can hold.
It makes you think.
Yeah.
If you were the one
Right.
in that hospital bed, what kind of support would you need to rebuild your confidence and get back on your feet?
That's such a powerful question.
It is.
And I think it speaks to the heart of what rehabilitative nursing is all about.
Tell me.
Recognizing the human being behind the illness and treating them with the dignity and respect that they deserve.
Absolutely.
You know, I love that.
It's all about the human element.
It is. It really is. It really is all about the human element, isn't it?
It is.
And speaking of those human hands that are providing that care, the curriculum goes deep on the practical skills that nursing assistants need to master.
So cool.
We're talking about cast care.
Oh, wow.
Range of motion exercises, using all those adaptive devices that we're just talking about. I mean, it's pretty impressive.
It is. It's fascinating. It's one thing to understand, like, the philosophy of rehabilitative nursing, but then you actually see, like, the techniques and procedures.
Right.
It really brings it to life. Okay, so let's zoom in on one of those practical skills.
All right.
Cast care.
Cast care.
You don't always think of that as being part of rehab.
Yeah, that's true.
But it makes sense.
Yeah. I mean, imagine you've got a patient with a broken limb, fresh out of surgery with a cast.
Sure.
The nursing assistant is right there.
Okay.
Making sure that cast is doing its job.
Right.
But also watching for any problems.
So it's not just about slapping on a cast and calling it a day.
Oh, no.
There's a whole lot of observation involved.
So much observation.
Right.
They're trained to be super observant.
Okay.
Checking the fingers or toes for any signs of swelling or discoloration. Asking the patient about numbness, tingling, pain.
Right.
It's all about catching those potential complications early on.
It makes me think about how crucial communication is in this field.
Oh, yeah, for sure.
Not just between the care team.
Right.
But with the patient, too.
Yeah, that's so important. The curriculum really emphasizes that constantly.
Yeah.
Asking the patient the right questions. Really listening to their answers.
Right.
Because they're the ones feeling it.
So,
what's going on under that cast.
Right. And it's not just about observation.
No.
There are actual hands-on techniques for cast care.
Absolutely.
Right.
Proper handling is key.
Okay.
Using the palms of your hands to support the cast. Avoiding any indentations while it's drying.
Right.
And then once it's dry, it's all about keeping the skin clean and dry.
Okay.
Preventing sores or irritation.
I'm picturing the nursing assistant gently cleaning around the edges of that cast.
Yeah.
Making sure everything is comfortable and in place.
Right.
It sounds like it takes a real blend.
I think so.
Of technical skill and empathy.
Absolutely.
To do that.
And throughout this whole process, they're also encouraging the patient to participate as much as they can, even with a cast.
That reminds me, the curriculum mentions using a trapeze bar to help patients move themselves.
It's like that circus image again.
Right. But with a completely different purpose.
I know, totally.
So what is the purpose?
It's a tool for empowerment.
Really?
Even with a cast on.
Okay.
That trapeze helps them reposition, get in and out of bed, gives them that sense of control.
Right.
And helps maintain some upper body strength, too.
It really highlights how creative rehab professionals have to be.
Yeah.
It's about finding those workarounds, those solutions that help people stay active and engaged in their own recovery.
Right. Speaking of staying active.
Okay, do it.
Let's circle back to those range of motion exercises.
Yes.
You touched on them earlier.
We did.
But the curriculum really dives deep into the specifics.
Okay, remind us
about
the different types of ROM
right.
and why they matter.
So we've got active ROM, where the patient does the work themselves. Passive, where the nursing assistant moves the limb. supports.
Correct.
And then active assistive.
Okay.
Or it's like a team effort.
Right.
The curriculum has a whole section
Right.
detailing how to perform these movements safely and effectively,
Oh, wow.
depending on the patient's needs.
It's like they're breaking down this complex process into manageable steps.
Yeah.
Making sure the nursing assistants have the knowledge and the confidence
Absolutely.
to work with all sorts of patients.
And remember, the goal is to get the patient as involved as possible.
Yeah.
So if they can move the limb even a little bit, that's where you start encouraging those tiny victories along the way.
I'm picturing someone recovering from a knee injury.
Yeah.
And the nursing assistant gently guiding them through those bending and straightening motions.
Exactly. You're helping them regain that flexibility, prevent stiffness, rebuild strength.
And it's not just the knees.
No.
The curriculum covers ROM exercises for every joint.
It does shoulders, elbows, wrists, ankles, even fingers and toes.
It's amazing to think about the dedication and the attention to detail.
It really is.
That goes into this work.
It's a head-to-toe approach.
It is.
And remember, it's not just about the physical mechanics.
Right.
It's about that human connection, too.
Yeah.
We talked about self-esteem.
We did.
And how important it is to encourage and support the patient throughout this process.
It all ties back to that holistic view.
It does.
Of rehabilitation, doesn't it?
It's not just a body.
Right.
It's a person.
Yes.
Their hopes, their fears,
Yeah.
their dreams for the future.
And that's where therapeutic communication comes in.
Exactly. Those seemingly simple interactions that can make all the difference.
Give me some examples.
A genuine smile.
Okay.
A word of encouragement.
Yeah.
Really listening to their concerns. It all adds up.
It's like you're saying.
Yeah.
Those small gestures are actually giant leaps forward.
I love that.
The recovery journey.
Yes, and it's something we can all learn from,
You're
even if we're not healthcare professionals.
Right.
You know, just thinking about how we interact with people who are struggling.
Yeah.
How we can offer support and encouragement in our own way.
And speaking of the bigger picture, I'm curious about the role of documentation in all of this.
Oh, yeah.
It seems like there would be a lot to keep track of.
A lot to keep track of.
Right.
You're right. Documentation is crucial.
Okay.
The curriculum stresses the importance of accurate and detailed notes.
Okay.
What the nursing assistant observes. How the patient responds to therapy.
Right.
Any changes in their condition.
So it's like they're creating this ongoing record of the patient's progress.
Yes.
Which can then be shared with the rest of the team.
That's right. Those notes become part of the patient's medical record.
Oh, wow.
Helping everyone stay informed.
Okay.
And make adjustments to the care plan as needed.
And it really highlights how important the nursing assistant's role is in this collaborative process.
Yeah.
They're not just carrying out tasks. They're contributing valuable information.
Right.
That shapes the patient's overall care.
And it goes beyond just recording observations.
Really?
The curriculum also talks about
Okay.
the minimum data set, or MDS.
MDS.
Yeah, have you heard of that?
I have to admit, MDS is a new one for me.
Oh, okay.
Can you break that down a bit?
Yeah, think of it as a detailed snapshot of the patient's functional abilities, health conditions, and even their psychosocial well-being.
Wow.
It's used to create a comprehensive picture of their needs and track their progress over time.
And the nursing assistant plays a role in completing this assessment.
Absolutely.
Okay.
They're the ones spending the most time with the patient, observing their daily activities, their interactions, their moods.
Wow.
They have a very unique perspective.
Yeah, they do.
That's really crucial to the accuracy of the MDS.
So it's like they're not just providing care.
No.
They're actively participating in the assessment and planning process.
Right.
They're really integral members of that rehab team.
Exactly. And that, I think, is one of the biggest takeaways from this curriculum.
What is it?
The nursing assistant isn't just a task doer.
Oh, wow.
They're a skilled professional
Okay.
who plays a vital role in every aspect of the patient's journey.
It really challenges the perception.
It does.
Of what a nursing assistant does.
I think so.
It's not just about making beds and taking temperatures.
Right.
It's about being a keen observer.
Yeah.
A skilled communicator.
Yeah.
A compassionate advocate for the patient.
It's about being a partner in the healing process.
It is.
And that's inspiring, isn't it?
It really is. It makes you realize how much potential there is for growth and development in this role.
For sure, and how much impact they can have on people's lives.
Wow. It's incredible to think about the depth and breadth
I know.
of this field.
Right.
We've talked about the goals of rehabilitative nursing,
Yeah.
the importance of teamwork preventing complications.
Mm-hmm.
We've explored all those hands-on skills,
Right.
from ROM exercises to using those adaptive devices,
Right.
and even the power of something
Yeah.
as simple as therapeutic communication.
And don't forget the crucial role of documentation.
That's right.
Those detailed notes that help track the patient's progress and inform the entire care plan.
It really is like piecing together a puzzle, isn't it?
It is.
With each observation,
Yeah.
each interaction adding a new piece
Absolutely.
to the picture
Right.
of that patient's recovery.
And it's clear that rehabilitative nursing goes
Yeah.
way beyond
But
just treating the immediate medical needs.
Right.
It's about helping people regain their independence,
Yes.
achieve their highest level of functioning,
Right.
and ultimately reclaim their lives.
It's about recognizing that even in the face of serious illness or injury, there's still so much potential
I think so.
for growth, adaptation, and a meaningful life.
Absolutely. And that's a powerful message.
It really is.
Yeah.
Rehab isn't just about fixing what's broken.
Yeah.
It's about empowering individuals to rewrite their stories,
Well, I love that.
to find new ways to thrive and contribute, even if their circumstances have changed.
Shifting the focus from limitations to possibilities.
I like that.
And the nursing assistant
Yeah.
is right there on the front lines of that transformation,
Yeah.
guiding and supporting the patient every step of the way.
So inspiring to think about the impact these professionals have.
Yeah.
It all comes back to that core message of the curriculum.
Right.
Rehabilitative nursing is about maximizing patient potential,
Yes.
not just providing basic care.
It's about seeing the person behind the illness
Yes.
and believing in their ability to heal and thrive.
So as we wrap up this deep dive
Yeah.
into rehabilitative nursing,
Rehabilitative nursing.
I'm left wondering about
Yeah.
the broader implications of this type of care.
Oh, that's interesting.
It's clearly beneficial for the individual,
Right.
but what about the impact
Yeah.
on society as a whole?
Like, what are the ripple effects?
Right.
If we invest in effective rehabilitation.
Yeah, does it ultimately save healthcare costs
Right.
in the long run?
Because you're reducing the need
Exactly.
for more intensive care later.
Does it help create a more inclusive society
Right.
where people with disabilities can fully participate?
These are important questions.
They are.
It makes you realize that healthcare isn't just about treating illnesses.
Right.
It's about investing in people's well-being
Yeah.
and empowering them to live meaningful lives.
Creating a world where everyone has the opportunity
Right.
to reach their full potential,
Yes.
regardless of the challenges they face.
Love it.
And that, dear listener, is a challenge worth pondering
For sure.
as you go about your day.
Mm.
Think about the ripple effects
Okay.
of effective rehabilitation.
Yeah.
How can we as individuals and as a society
Yeah.
support and champion
Support and champion.
this vital aspect of healthcare?
It's a conversation worth having
It is.
and a journey worth taking.
Thanks for joining us on this deep dive.
Absolutely.
Until next time, keep learning,
Mm.
keep questioning, and keep exploring the world around you.